All right, good evening. I'm Dr. Hagmeyer, and I want to welcome you to this video series titled Thyroid Treatment Success Secrets. What we've been doing over in the last couple of videos is really just going through some integral parts of why the thyroid begins to dysfunction. We've been talking about a couple different supplements that are problematic, and we're going to continue with that discussion today. We're going to talk about the dangers of tyrosine. Okay, now tyrosine is another very, very popular supplement in health food stores today. Many people who are suffering with thyroid problems will go to a health food store. They'll walk into maybe Trader Joe's or Whole Foods or some other type of natural health food vitamin shop, and they'll talk to their next door neighbor perhaps who sells vitamins, and they will share with them that they have a thyroid problem, and that individual may suggest that you take something called tyrosine. Okay, the first thing that they'll tell you about is iodine, why you should take iodine, and we discussed that in the last video. But the very next thing that they'll tell you to take is tyrosine. Okay, so I want to spend some time talking about tyrosine today. So just like iodine, tyrosine is a very integral part of thyroid hormone production. The problem is that simply supplementing it with tyrosine has the potential to suppress thyroid activity. So just because our thyroid hormones are really made from tyrosine, remember we talked about tyrosine being the backbone of that thyroid compound, that thyroid molecule. It's the backbone, but simply taking tyrosine, that doesn't necessarily mean that you're going to be able to implement it or to utilize it to make thyroid hormone, okay? The problem with tyrosine that I see over and over again is that tyrosine has the ability to increase the adrenal output of the hormones. And so if you've been following any of my blogs or watching any of my other videos, you know just how critical healthy adrenal function is to thyroid function. So in other words, you never have the thyroid just shut down by itself. You always have many, many other factors that are also shutting the thyroid down. And just one of those other factors is the adrenal glands, okay? Here's the problem, is that when you take tyrosine, tyrosine can have the ability or have the potential to put more stress on the adrenal glands. And so one of the things, one of the hormones that's very important that is secreted by the adrenal glands is something called epinephrine. So epinephrine is what gets your heart beating a whole lot faster. It's what causes things in your body to vasodilate. Okay, it basically is your fight or flight response. Okay, what epinephrine does, and norepinephrine and serotonin, these are three chemicals or three neurotransmitters, three hormones that are constantly being released in relationship or in response to a fight or flight response. And so if you're taking supplements that have or contain tyrosine in them, you could potentially be causing an increased stress response. And again, you would feel more depressed, more anxiety. You might feel a sensation of just being wired and tired at the same time. You may experience some mental fogginess, okay? You may wake up with disturbed sleep cycles, okay? Specifically, typically, I find that people will wake up anywhere between 1 a.m. and 3 a.m. Okay, so you see that one of the worst things that you could really ever do as a patient is take a patient who is in an active stress response and then give them something like tyrosine or iodine that is only going to stress those stress handling glands out even more. Okay, so what I always encourage people to do is this is something that you really have to be tested for. Okay, because again, to overstimulate the stress handling system in the body is going to wear out the thyroid gland even more, okay? And so since most thyroid patients are already suffering with some sort of chronic stress response, taking tyrosine and iodine once again can further exhaust the thyroid gland as well as the adrenal glands, okay? So it's my recommendation here that any patient who has a thyroid problem and is taking thyroid medications, that you get properly tested and you get retested, okay? Don't just walk into the natural health food store or talk to your next door neighbor who's selling vitamins and ask them what you should be taking. Okay, there are specific tests that you really need to have. So my advice here is work with a doctor who really will run the proper tests on you and determine what's the best course of action in order for you to get better, get your life back, and get feeling good again. Okay, so remember, my motto is test, don't guess, okay? In closing the secret, in this video success secret, remember to look at supplements, read your labels, and make sure that you avoid anything with iodine or tyrosine in them, okay? Take care.